Hello, all. It's so nice to be here again with you today. It's still February, so at Women Heart, that means it is still our 29 Days of Heart campaign. I'm Selena Gore, the CEO at Women Heart, and we are a national patient-centered organization focused on providing support, education, and advocacy to women living with or at risk of heart disease. And like I said, it's still February, so that means at Women Heart, we combine Heart Month and Black History Month. And the way we do that is with our 29 Days of Heart campaign. We uplift voices of Black women with heart disease, and we shine a spotlight on the inequities that exist specifically for Black women to provide empowering and motivating education and information so that everyone can take control of their heart health. So if you are interested in learning more about that campaign, please go to womenheart.org/29 Days of Heart, and you can read all that information that you need and see all the past videos that we've done, all the past lives that we've done, featuring some of our amazing Women Heart champions. And we also get to spotlight our amazing partner organizations. And today we have the privilege of speaking with Diabetes Sisters, and I get to talk with Anna Norton, CEO of Diabetes Sisters. And Diabetes Sisters, as I understand, offers education and support to women of all ages with all types of diabetes. And this is critical because, as we will learn and talk about now, there is a very, very close link between diabetes and heart disease. And so let's get right into it. Anna, tell us about Diabetes Sisters and what your mission is.
Well, hi, Selena. It's really, I'm so excited to be here and to be on this platform with you. Diabetes Sisters is an enormous fan of Women Heart. Love the work that you do. We have always followed you and are always so grateful whenever we are able to do any kind of partnership with you, especially today when we're talking about something that is so important in the women of color living with diabetes community. But a little bit about Diabetes Sisters. Diabetes Sisters is a national nonprofit whose mission is to provide support and education for women that live with any kind of diabetes. And that includes pre-diabetes, which is something that we see very, very often, especially among our Black community of women. Such huge numbers. There's a huge disparity in equity there. When we think about some of the numbers, about 15% of Black women live with or are affected by diabetes in one way or another, yet Black women only account for 13% of the US population.
Wow.
So that's an incredible, when you think about that just doesn't even seem, it doesn't seem right. It's not just, it's not fair. And so that's something that we really aim to look at and really aim to educate all people, but especially Black women, women of color, Hispanic, Latina women, any minority group that is underrepresented when it comes to healthcare.
Yeah, talk a little bit more about that. I mean, we talk about that through our 29 Days of Heart campaign, as one way that we highlight these inequities specifically for Black women. But with in Diabetes Sisters, do you have ways that you specifically address and highlight these inequities? And I love the fact that you use the word justice. It's a point of justice. It is an injustice. We talk about it in the same way at Women Heart.
Absolutely. So one of the programs that we launched back in 2016 was our Welcoming Diversity Elevating Voices program. And that's really to talk more, not just about diabetes in general, but to talk more about diabetes, type 2 diabetes, and the intersection with women in underrepresented communities.
Yeah.
We started back in 2016 at a health ministry right outside of where you are in Silver Spring, Maryland, where we brought together just the entire group of women that belong to this ministry, and we asked them questions about diabetes. Mm-hmm. And what we heard women say was that many of them had been diagnosed with pre-diabetes. And when they asked their physicians or the practitioner that diagnosed them what they were to do, they were just instructed to come back in 1 year.
That was the only instruction, is to come back.
No, that was it. Just come back in 1 year. Come back in 1 year. And so what we heard from this group of women was that they were really outraged. Mm-hmm. They were very upset, and they said, We don't want to come back in 1 year and hear that it's no longer prediabetes, but that it's type 2 diabetes. And we heard the whole laundry list of the misconceptions and the myths that come with a diabetes diagnosis.
Mm-hmm.
And so these women became very, very empowered when it came to their health and what they could do, not only to prevent it, but if the diagnosis did come, how to treat it,
Mm-hmm.
and how to find ways that were not just medical, but also social and emotional ways of coping with chronic disease. And so we heard a lot of conversations about where's the intersection? Heart disease, kidney disease. Am I going to go blind? Will I lose feeling in my extremities? So a lot of questions about neuropathy, and then a lot of questions about depression. And when we started to talk about Black women specifically, there is a lot of risk there for depression and anxiety. Especially for women who are sort of sandwiched in their lifestyle, right? Because many women are mothers and their wives and their daughters and their nieces, and they take on the role of many responsibilities in their lives. And oftentimes their personal health falls low on their list of priorities. And it's very, very difficult to come back from that if you are really wearing yourself thin and all of the other aspects of your life. And so that is something that we really wanted to focus on. Again, not just prevention, but if you already have something, how to treat it in the most humane and graceful way that you possibly can, so that you don't miss out on what you need in order to continue to live as healthy as you possibly can.
Anna, you mentioned being part of sort of this sandwich generation, and that increasingly you're seeing women in both as, taking care of their kids and then also taking care of their parents. Can you talk a little? So at Women Heart, we see that the women showing up to become volunteers or Women Heart champions with us, that the age of these women is slowly, but unfortunately, getting younger and younger. Do you see that similar sort of trend at Diabetes Sisters? The women that you encounter, is the age sort of average changing over time?
It is. It has. So we were founded in 2008. And have always seen a great spectrum of ages. But most of our volunteers, which are the leaders who lead our monthly support meetups all over the country, we're always seeing that skewed to a little bit older. We are seeing younger, and we're seeing younger women diagnosed with type 2 diabetes that belong to minority groups that are becoming more involved. And I feel that social media is both a curse and a blessing. But in this case, I think that it's a blessing because members of our groups have found us through social media, and they have created platforms in order to really properly educate Black women about what diabetes is and what it isn't. And I think that that's very important to see that. But we are also seeing women with families, women with careers, women who are highly educated, not just higher education, but also that they have healthcare education. They have higher health literacy. And again, that helps to dispel a lot of the myths in minority communities.
Yeah, it's an interesting thought that, even those who have high health literacy are still coming down with prediabetes and diabetes. And it's the same with heart disease. And, let's focus on one specific risk factor that is true for both diabetes and heart disease, and that's diet, a healthy diet or an unhealthy diet for that matter. Can you talk at all about any types of programming that you all might do? And I'm thinking specifically about, addressing diabetes or prediabetes in communities of color, where it might be really challenging to figure out how to eat healthy, but still eat the foods that you love from your culture or from, how you grew up. Is there anything in Diabetes Sisters that helps women kind of to reimagine how they might eat their culturally appropriate food?
Yeah, I love that. I love that you asked that. So I am Hispanic Latina and come from a long line, obviously, of Hispanic Latinos. And one of the things that we see is that a lot of our celebrations are centered around food. A lot of our culture is centered around food. And that is the case for probably every minority group. That's
Yeah.
how we gather, and that's how we express love, and that's how we express even our fortune,
Yes.
that we have a table that's full of food. Um, I learned through our Welcoming Diversity Elevating Voices program in two beautiful instances. One, we had a group of Hispanic Latina women asking questions. We had a group in South Florida, and they were asking questions about whole grains and how to
Mm-hmm.
incorporate that into a Latina diet, right?
Mm-hmm.
Which is really fabulous. And
Yeah.
the second one was the same group that we met with in Silver Spring. We were able to host a Thanksgiving dinner using non-typical foods that this group of women typically that they saw at their table normally. And so what we saw initially was women who really had no interest in learning about what these foods were. So we had a turkey breast instead of an entire turkey. We had sweet potato instead of white potatoes.
Mm-hmm.
Uh, uh, Cranberry sauce made with no sugar, and then roasted vegetables instead of boiled. And what was really wonderful was that the chef explained why those things were better health
Mm-hmm.
wise, why they had more nutrition in them.
Yeah.
And then we talked about where you could purchase these things. So,
Amazing.
right.
Yeah.
So not an elevated price point of the items, not something that you couldn't buy at your local grocery store, not something that you could not afford. And by the end of the evening, I think we had converted every woman in the room except for one. But the point is that we do not have to give up our culture and our traditions because we have diabetes or because we have heart disease or because we're trying to prevent something that may be in our genes already.
Yeah,
Right?
it is really interesting. So I came across some tortillas one time made out of almond flour. And I read the story of the family on the package, and it was exactly that this family, there was somebody who was gluten intolerant in their family, and they decided that they, wanted to try something else, and they created this whole line of other tortillas made of other types of flour, which
Exactly.
again, like really
Exactly.
being creative, but still staying kind of within the traditional types of cuisine.
Yes, and then just trying to and I think when we talk about underserved communities, or communities of color, it's not one person making these changes. It's very familial.
Yeah.
And so I think everyone needs to be involved in these changes. And we always say at Diabetes Sisters, it's not about perfection. It's about progress.
Right.
It's about progress, which is a really wonderful way of approaching health.
Absolutely. Yeah. And I mean, at Women Heart, we talk about the journey, right? And
Mhm.
the journey sort of implies change over time. Um,
Exactly.
and, pacing, I talk a lot about pacing change. If you try to change everything too drastically, too quickly, then that change is not going to stick. But if
Yes.
you can do it gradually over time so that you kind of integrate these small changes, and then before you know it, after a year, you realize, oh wow, I'm eating much more healthily because I.
Absolutely. And when it comes to family and it comes to groups of people and communities, we can pass that down,
Yes.
right? Slowly and surely and gradually. And so our next generations are not living with fear. Well, I'm going to be diagnosed with diabetes, or I'm going to have a heart attack. I'm predisposed. So yes, again, genes do play a part in a lot of it, but environment does too, especially when we talk about type 2 diabetes
Yeah.
or heart disease, or kidney disease, or a multitude of things. When we talk about weight management, we talk about obesity. That's a big topic now, especially among communities of color.
Yeah.
And so if we can start to change the landscape little by little, we'll be much better off later.
And I don't want to leave the point just yet about food and culture, because I myself was born in the Philippines, and there are some foods in in Filipino cuisine that is pretty unhealthy, but there are other types of foods that is extremely healthy.
Mhm.
right? And freshly grilled fish, that is, that's a staple. Fresh vegetables. So I think there's also, I would challenge us to, when we think about our own cuisine from our home countries, um, that we think about what there are healthy aspects of that diet as well, and to
Absolutely.
focus.
Absolutely, and there are different ways to prepare our foods.
Yeah.
Um, you know, food culture today is really embracing things. I don't personally own one, but the air fryer is a huge thing now. So
The air.
how to get those fried flavors, right? That can be very comforting in our
Yes.
cultures. How to get those flavors without bringing in all the unhealthy portion of it.
Yeah.
The extra fat or the extra calories or the deep frying. And so, the culture is starting to play a big role in how we're seeing the approach to food.
Absolutely. I want to switch gears for a minute and talk a little bit about what happens. You brought this up in the beginning, but what happens when a woman goes to see a healthcare provider? And you spoke to some really unacceptable experiences that some women have had until to come back after a year. But what should women expect, or what should women ask for, in order for them to learn what their status is in relation to diabetes?
Well, I think in relationship to diabetes, women should know their ABCs, right? So that's their hemoglobin A1C, their blood pressure, their cholesterol. Those are the first three things, right? They're very, very important numbers. So, what are the numbers and what do those numbers mean?
Hmm.
And what are the risk factors associated with having numbers that are outside of those ranges?
Got it.
So I think that's the first thing, and I think that women, especially women of color, when they go to their healthcare provider, should come armed with questions, and I
Absolutely.
think that they should be their biggest advocates. Healthcare today is difficult.
Yes.
Doctors and providers want to get you in and out, right? 15 minutes, 12 minutes, that's all you get. You have to make the most of that. You know, in minority cultures, sometimes we're really accustomed to saying yes, yes,
Hmm.
yes. Oftentimes feeling ashamed
Hmm.
when we're in a doctor's office, and there's no time for that. There's
No,
no room for that.
exactly.
We have to come in there. We have to say, these are the questions. What are my numbers? What can I do to keep them this way? What can I do to change them? What are the treatments? And never take no. And I think another big thing is having the knowledge that we can fire our healthcare providers.
Absolutely.
So if we are
Abs-
not satisfied, we can move on and go to a different one and find one that fits, find one that listens, find one that is proactive and not reactive about our health. And I think that oftentimes we sometimes don't think that. We say, like, this is the doctor and this is what the doctor says. There's a lot of doctors out there, a lot that are very, very cognizant of the social and emotional needs of people,
Yeah.
minority groups, and the fact that we're not perfect patients, that,
Absolutely.
that we have lives, we have jobs, families, struggles, lack of resources sometimes, and so there are physicians and healthcare providers that take that into account and can help customize treatment that way.
That is such a good tip. And I mean, I guess when you say good fit, we talk often about making sure that you trust your healthcare provider, right? And you are able to build a relationship with them. I mean, that is fundamental to being able to understand very clearly what they are recommending to you, and what sort of treatments are recommending,
Yeah,
etc.
absolutely.
So that's really, really key. And as we're wrapping up, I just wonder if you had maybe one piece of advice for any woman who's listening, who is either you know trying to get something diagnosed, whether it's prediabetes or diabetes, or they're worried about the link between diabetes and heart disease. Is there one word of advice that you might want to share with them?
I think that as women in 2013, living in the United States of America with so much access to information, the best thing that we can do is arm ourselves with information. So go to websites like Women Heart, go to websites like Diabetes Sisters, learn from peers, learn about experiences, educate yourself.
And I love what you said, arm yourself with questions so that when you go and see your healthcare provider, you can make the most of that time.
Absolutely.
That is so key. Anna, thank you so much. It was so fun spending some time with you and learning more about Diabetes Sisters.
Yeah, thank you. Thank you for doing all the wonderful work that you do with your health, your heart champions. We love them. All the work that you do. Have a wonderful afternoon.
Thank you. And we invite anyone who's listening to learn more and take action. Please visit womenheart.org/29 days of heart to learn more about our campaign. And I will see you back here on Tuesday next week, where we have our final interview of our 29 Days of Heart campaign with our champion, Pamela Thomas. Thank you so much and see you then.